Assalamualaikum warahmatullahi wabarakatuh. My name is Fitria Rahmatul. I'm from Chemistry 19. I will talk about teenage pregnancy, especially the factors influencing to the incidence of teenage pregnancy. The aim of this study was to know factors related to the incidence of teenage pregnancy in adolescent girls in Saptosari Public Health Center working area in 2017. Why the study object is adolescent girls in Saptosari Public Health Center working area? We should move into the next slide to know the reason. Basic health research risk DAS in 2013 found that pregnancy at age less than 15 years old, especially in rural areas, with a proportion of 0.03%, and the proportion of pregnancy at the age of 15 to 19 years old is equal to 1.97%. Then the Indonesian Family Planning Association of Special Region Yogyakarta (BKPI-DIY) 2015 report labor youth in DIY as much as 1.9% and 1.72% comes from pregnancy is not desired. Then the case of labor adolescents must occur in Gunung Kidul Regency, that is 0.71%. We can conclude that teenage pregnancy is related to labor youth, especially in Gunung Kidul Regency. Then Health Office of Gunung Kidul note that proportion of the labor youth in Saptosari district in the year of 2013 to 2016 fluctuated. We can see the chart about the proportion of the labor youth in Saptosari district. In 2013, the percentage is 17.2%, then decreased in 2014 at 14.24%, then decreased again in 2015 at 7.6%, then increased in 2016 at 9.67%. So we can conclude that in Saptosari district, Saptosari district has highest case about teenage pregnancy according to the proportion of labor youth. Then why this study about teenage pregnancy? Because according to the Manuapa, teen pregnancy has risks such as bleeding at the partum, increase in preeclampsia and eclampsia, anemia, impaired fetal growth, miscarriage, prematurity, and low birth weight. So teenage pregnancy most risk than pregnancy in adult. So we should decrease the percentage of teenage pregnancy. Okay, move to the method. Sampling. The number of samples of this study was 67 young women, and the inclusion criteria is young women aged 11 to 20 years old and live in Saptosari Public Health Center working area. Then the exclusion criteria is the women who have a history of illness in their pregnancy, and then data collected in analysis used primary data through a questionnaire used and variative analysis with frequency distribution, bivariate analysis with chi-square using SPSS. We move to the result. In table 1 is relationship between teenage pregnancy and knowledge. Knowledge in this study means knowledge about sexuality and about reproductive health. So teenagers should have education, understanding about reproductive health and sexuality. It can decrease the possibility of pregnant in teenagers. And the result of p-value is 0.003 0.32 is less than 0.05. So there was a significant relationship between knowledge about teenage pregnancy with the incidence of pregnancy among adolescents. And the table 2, the relationship between teenage pregnancy and attitude. We can see that the p-value is 0.081, that is more than 0.05, so no significant relationship between attitudes toward teen pregnancy with the incidence of teenage pregnancies. And next to the table 3, the relationship between teenage pregnancy and it at parents' role. Parents should give sex education and health reproductive health to their children, so the possibility of teenage pregnancy can decrease. We can see that the p-value is 0.036, less than 0.05. So there was a significant correlation between the parental rules with the incidence of teenage pregnancies. And the last table about teenage pregnancies and peer role. We can see the p-value is 0.1, more than 0.05. So no significant relationship between the role of peers in the incidence of teenage pregnancies. Okay, the conclusion, the factors that associated with the incidence of teenage pregnancies in the studies were knowledge of teenage pregnancy and parents' role, while the factors that not related to incidence of teenage pregnancy were the attitude toward teenage pregnancies and peer roles. Thank you. Assalamualaikum warahmatullahi wabarakatuh.